Social stress in everyday life. Anti-anxiety agents. 39. Chemotherapy. Windows of Medicine Unit 10. AIDS. Getting a handle on treatment. Deficiency means that a lack of something. Immunity means that the condition of being able to resist a particular disease. Diagnose means that to identify the nature of means that to identify the nature of an illness by examination of the symptoms. Infection means that invasion of the body of bacteria or viruses. Suppress means that to inhibit the growth or development of something. Not too long ago, most people thought that contracting HIV was a certain and swift death sentence. After several decades of experience with this deadly disease, however, medical scientists have found drugs and treatment strategies that now allow HIV patients to live years or even decades with the disease. It is essential for those who have contracted HIV to be diagnosed early so that monitoring or treatment can begin as soon as possible. The scientific community has accepted that the cause of AIDS is HIV. Once an individual has been infected with HIV, the virus quickly attacks the infection-fighting soldiers in our immune system, called T cells. Damage to these cells slowly destroys the body's ability to fight disease. After infection with HIV, a person may be symptom-free for years, but eventually the number of HIV viruses in the body, his or her viral load, will increase while the number of his or her T cells will decrease, weakening the person's ability to fight disease. Advanced HIV infection is known as AIDS. AIDS patients often die from opportunistic infections, OIs, which are serious infections from bacteria, viruses, or fungi that our body would normally be able to fend off. Through research and experience, scientists have learned the importance of tracking the viral load of HIV in the body as well as the patient's T cell count. It is essential to suppress the viral load early in the disease cycle while maintaining and boosting the level of T cells, allowing patients to fight off OIs. There are powerful drugs and drug mixtures now available that are doing this with increasing effectiveness. With this therapy, many patients with HIV have been able to live longer periods of time without developing AIDS. Some of the drugs that have been effective in fighting AIDS are zolpidem, azathioprine, and a class of drugs known as HIV protease inhibitors. Although these new drug therapies can delay the advance of HIV in the body, the virus will eventually overcome the immune system and the patient will develop AIDS and die. Today's science can only slow the progression of the disease. However, with each new day, new discoveries are made and the patients are living longer and longer. Doctors are hopeful that in the near future, HIV-infected people will be able to live totally normal lifespan. contract death sentence be optimistic at the HIV protease inhibitors.
Unit 10. AIDS. Getting a handle on treatment. Reading. Not too long ago, most people thought that contracting HIV was a certain and swift death sentence. After several decades of experience with this deadly disease, however, medical scientists have found drugs and treatment strategies that now allow HIV patients to live years or even decades with the disease. It is essential for those who have contracted the HIV to be diagnosed early so that monitoring and treatment can begin as soon as possible. The scientific community has accepted that the cause of AIDS is HIV. Once an individual has been infected with HIV, the virus quickly attacks the infection-fighting soldiers in our immune system, called T cells. Damage to these cells slowly destroys the body's ability to fight disease. After infection with HIV, a person may be symptom-free for years, but eventually, the number of HIV viruses in the body, his or her viral load, will increase, while the number of his or her T cells will decrease, weakening the person's ability to fight disease. Advanced HIV infection is known as AIDS. AIDS patients often die from opportunistic infections, OIs, which are serious infections from bacteria, viruses, or fungi that our body would normally be able to fend off. Through research and experience, scientists have learned the importance of tracking the viral load of HIV in the body as well as the patient's T cell count. It is essential to suppress the viral load early in the disease cycle while maintaining and boosting the level of T cells, allowing patients to fight off OIs. There are powerful drugs and drug mixtures now available that are doing this with increasing effectiveness. With this therapy, many patients with the HIV have been able to live long periods of time without developing AIDS. Some of the drugs that have been effective in fighting AIDS are zidovudine, AZT, nevirapine, and a class of drugs known as HIV protease inhibitors. Although these new drug therapies can delay the advance of HIV in the body, the virus will eventually overcome the immune system and the patient will develop AIDS and die. Today's science can only slow the progression of the disease. However, with each new day, new discoveries are made and patients are living longer and longer. Doctors are hopeful that in the near future, HIV-infected people will be able to live a totally normal lifespan.
2.
HQs.豚の走る動機が反応した。